somebody really a strong man up on Capitol Hill in the United States Senate, our senior senator, Dr. Bill Cassidy, on our Newsmaker hotline. Dr. Bill, welcome in.
Hey, Tom Pace, thank you for having me.
Well, you don't know my thrill to see you today over at Shreveport Regional Airport, over there in Bossier Parish at Bipstall, and all the things that you're talking about. It's great to have you in town. Glad to see you here, but more importantly, you were rocking that LSU Tiger tie. It looked like it was purple, and there was stripes out of gold, like a tiger paw had gone through that tie.
It was a big tiger eye at the bottom of it. So I'd like to think you're enthused because of all the good stuff we've gotten done for Northwest Louisiana, but you're really enthused because of that tie. And by the way, I'm with you on it.
All right, well, good. Even though they're a 14.5-point dog, I think they can rise to the occasion. And speaking of rising to the occasion, you, Congressman Mike Johnson, came in tandem today for a number of things. One, to take a walk around the Shreveport Regional Airport, take a look at the big $16 million that's been appropriated for runway construction and repaving and everything. How is that looking, sir?
Really good. The money is appropriated. These are dollars that are going to be spent somewhere in the United States to upgrade airports. And if it's going to be spent, I want it to be spent in what I consider one of my hometowns, Shreveport. Because the success of Bossier-Shreveport area is related to many things, but one of them is first-class air service. Frankly, your airport needs to be upgraded. I'll just say that. It's no mystery to people in Shreveport. Your runway, you've got a top flight one runway, but your other runway needs to be a little bit extended so that flights can have a full load of fuel and a full load of cargo. This grant allows your second runway to be extended so it can take off with a full load, again, of passengers, cargo, and fuel. The terminal will be another issue, and that's down the road, but it's also important to address, but you take things one step at a time.
Amen. And thank you for being there this morning with the delegation, if you will, from the city of Shreveport, you and Congressman Johnson. From there, you did a quick hop over toward Bossier Parish at a place they call Bipstall, shortened, that has a Student Technology Innovation Learning Center over there just off of Swan Lake Road. And there was a big presentation that you made, sir. What was that?
So let me back up a little bit before I answer the question. For Northwest Louisiana to do well over the next 50 years, people who are 18, 19, and on through their early 30s need opportunities to create these new businesses in this new economy that will reshape our economy and, again, build those jobs that will be employing folks for some time to come. About 2 years ago, I had a round table. Dave Smith was there. 131 or 81 different entrepreneurs from Northwest Louisiana participated in some way. And I got the message. The message was folks needed technical assistance. They needed some guidance as to how to help their business go to scale. From that vision, that conversation, we've been working on a grant that would create what they call NORLEAP, Northern Louisiana Entrepreneurial Advancement Program, I think it is. Yeah. Entrepreneurial Advancement.
Pronounced NORLEAP.
NORLEAP. And so the federal government puts up $600K, the federal taxpayer, if you will, and then BRF puts up another $600K. And this is used to put in the technical assistance, the systems, the other things that can help these young businesses become those sorts of businesses that, again, guide our region. Not just for Caddo, Bossier, but for 21 parishes across North Louisiana.
And you see, that's exactly what your dollars at work up on Capitol Hill are doing. You are providing a hand up, and so is the BRF here, and it's going to be $1.2 million over the next couple of years. Great stuff. Congratulations, sir. Now let's go to some important topics. I'm going to start with the most important, but then I want to get to opioids and all of your bills that are have been at the president and that are either being signed, have been signed. So, number one, everybody wants to know about this big caravan of illegal immigrants that's some 5,000 strong, and the president has ordered up guard troops, federal troops, to meet them at the Mexican border and turn them away if all they're doing is wanting to come here. Do you agree with that? And what do you think about that?
We have to be able to secure our border, and we can't have 5,000-6,000. We can't have one person who just presents themselves illegally and demands that the United States do their will. No, you come in this country as a privilege. And Tom, our country has always been generous to others fleeing persecution, religious persecution or other means. But some of these folks will be coached by reporters who will tell them exactly what they need to say in order to get that refugee status. It's not that they are refugees. They've been coached by attorneys as to what to say so as to present themselves as refugees, even though they are not. Now, that is gaming the American people. It is taking our generosity, playing upon it to achieve a goal that's outside the law. The president, through a variety of ways, is trying to address that, and I agree with the president.
All right, you're the senior senator up there on Capitol Hill, Senator and Dr. Bill Cassidy, a medical doctor on top of everything. And Senator Cassidy, you talk about that medical part that you are a doctor. One of your big concerns has been opioids and the opioid crisis, fentanyl and everything else. You've worked really hard in getting some bills through the Senate. Can you kind of annotate a couple of the bills, what they stand for, what it means to the people?
Yeah, we have multiple amendments on the latest opioid bill that President Trump signed into law this past week. And my amendments and the bill in general does things such as making it easier for law enforcement to track down when somebody might be doctor shopping or when a doctor might be overprescribing on purpose for financial gain. To make it easier to get treatment if you are an addict, both by making increasing the availability of medicines, which would cut down on cravings, but also Medicare and Medicaid paying for additional days of treatment more than they already do. We have one of my things. If there is a place doing treatment, you want to make sure they're doing it right. And so we have estimates of how well these different treatment centers are working. If they're working well, they get more business. If they're not working well, we ask them to shape it up, and if they don't shape it up, we shut it down.
And let me before you go any further, I just have to send you a round of applause and greetings from the people, the executive director at the Cato Alcoholism and Drug Abuse Center, CADA, from Bill Rose over there, and also Susan Reeks, because you have toured the CADA facilities and they have escorted you around. You have seen those, and they are top notch, not just in Louisiana, but the United States. And they send you greetings and said anytime you want to come back, they're welcome to give you another tour.
That tour of CADA was fantastic. And they had a young woman there who spoke movingly of being raised by a woman who, I forget, an alcoholic or an addict of some sort, she herself moving through addiction, but at some point, after having a child, realizing her life had to be better, and CADA helping her come to sobriety and bringing her to the point where she can help others. Incredibly powerful. Those are the sorts of programs we need more of. And that tour showed me how Northwest Louisiana is doing such, at least that organization is doing such a great job. And believe me, I very much had them in mind as I was drafting some of my amendments.
Well, God bless you. And now let's go to another bill, and I think it had to do with generic prescription prices, things of that nature.
Well, we've done several things to lower drug costs. And the latest is something that President Trump signed into law about 3 or 4 weeks ago. This bill, let me back up a little bit. Louisiana independent pharmacists came to me about 2 or 3 years ago and said that it may be that a patient could save money by paying cash instead of our insurance copay. But we have a contract with the
the healthcare provider.
Yeah, we have a contract with the insurance company that forbids us from telling the patient that she could save money by paying cash. And so that's not right. That can't be right. So the independent pharmacists brought that to D.C. 3 years ago. We've been working on it since, building a coalition. The president signed into law 2 or 3 weeks ago a law which forbids these sorts of gag clauses. Now the pharmacist works for you. They don't work for the insurance company. One example, Tom, I was speaking to a fellow down in Metairie. He says he went in to get Lovenox, a certain medicine, and it was going to cost him $190 to go through his insurance. He just happened to think, what if I paid cash? So he asked the pharmacist, how much if I pay cash? Turns out it's only $70 if he pays cash. He saves $120 by paying cash, and he wouldn't have known if he hadn't thought. Let's ask. From now on, the pharmacist can tell him as opposed to him having to know to ask.
And that was one of the things, if I remember, Dr. Cassidy, that was so powerful, is that the actual pharmacist who could see the prices, they were forbidden. Their hands were tied by this law or by their contracts with those insurance providers, and they couldn't even offer that advice, nor could they even give it if somebody goes, oh, could I get it for cheaper? So you have put a solution to a harrowing problem and also save the consumers money. Is that fair?
Absolutely. And my strategy, I'm a doc, as you mentioned, I've learned if the patient has the power, the system lines up to serve the patient. We want the patient to have the power of knowing the price. By the way, I think that kind of applies to a lot of things. If the average American has the power, the system lines up to serve the average American. But if it's a high-tech company, if it's the government, if it's an insurance company, if they have the power, then really the American is at their mercy. I want the American to have the power.
And then let me wrap up, and thank you so much for your time, Doctor, and our senior senator on Capitol Hill, Bill Cassidy. I would be remiss if I didn't ask you about this upcoming set of midterm elections right around the corner. This happens to be today, November the 3rd. That means really about 72 hours starting tomorrow before they start casting the ballots. Where do you see the Senate lining up? Will the Republicans still maintain control? And what do you think about the House? Now, Congressman Johnson said, I think we could, but it's going to be tight in the House. Can you give me the Senator Bill Cassidy projection?
I think we do keep the Senate. I think it is tight in the House. Right now, conventional wisdom is that Democrats take back the House. I will point out, today's jobs numbers showed 250,000 jobs added to our economy last month with wage growth, and that wage growth principally among the lower income folks. We've got record low unemployment for high school dropouts, for people of color, for veterans, women doing better than ever, people with disability doing better. And so if people vote their pocketbook and they vote the economy, I think Republicans get back in. If they decide they're so mad at President Trump because of his tweets, we could be in trouble.
Dr. Cassidy, thank you so much. Also, thanks to Sean Hanscom, your great media coordinator and public relations, whatever you call. What do you call him? Communications director? I don't know what.
He's a communications assistant.
He does an excellent job. Hats off to your entire team. And I will just say that on behalf of the Talk of the Town and Tom Pace. And Senator Cassidy, may all of your travels be safe. God bless you, and God bless America.
Hey, thank you, Tom, for having me on, and I give it back to you, brother.
All right. Look forward to you next time you're in town, sir.
Yes, sir.